Hi and welcome back to my channel. Today we are continuing a lesson on diabetes. In the previous video, that is our part 1 of the video, we get to know the meaning of diabetes, and then we look at some of the types of diabetes. In today's video too, we are continuing and we are going to look at some of the causes and then the warning signs of diabetes. Are you with me? Let's start. Hi, Ike.
Hey, Charity.
What's up? What's up?
Adi.
We are here today again, right?
Sure.
So, Ike, in the previous video, you talked at length various types of diabetes.
Sure.
Now, we want to know what at all brings about this diabetes. What are some of the causes?
Okay, thank you once again.
You're welcome.
So, the causes of diabetes, the exact cause is unknown.
Okay.
But we have some predisposing factors.
Like some risk factors?
Risk factors.
Okay.
Some of them are 1,
Okay.
genetics.
Genetic? Okay.
2, autoimmune disorders.
Autoimmune? What is that?
Okay, when you say autoimmune disorders, the body immune system must fight against any foreign body that enters into the body.
Okay.
But when you have autoimmune disorders,
Okay.
the cells that are fighting against itself. So when such happens, the cells or tissues are destroyed,
Okay.
or they get damaged.
Sure.
So that is termed as what? Autoimmune disorder.
Disorder.
So when such happens, the cells in the pancreas can get destroyed,
Okay.
and thereby leading to what? Diabetes.
Diabetes.
Okay, today we have some sedentary lifestyle. You don't do exercise, you eat like anything. No. You have to watch all of that. And again, it's obesity.
Obesity.
Gestational diabetes, or pregnancy-induced diabetes.
Oh wow, pregnancy.
Yes.
Okay.
So most women, those who are pregnant, when during their gestational period, they get diabetes. And we have another one which is associated by other conditions.
Okay.
Other conditions like pancreatitis.
Okay.
When you have inflammation of pancreas or chronic pancreatitis, it can damage the cells.
Okay.
As I said earlier on, the cells are called beta cells in islet of Langerhans.
Okay.
When we have tumors of the pancreas, it can also destroy the cells, thereby inhibiting the production of what? Insulin. And when you have surgical removal of the pancreas, the glucose will remain in the blood, leading to diabetes.
Wow.
All these factors can put you at risk of what? Getting diabetes.
Okay, I see. So, what are the warning signs of diabetes?
For the signs and symptoms of diabetes, we have some 3 classical signs,
Okay.
which everyone with diabetic will experience. So these are polydipsia, polyphagia, and polyuria.
Okay.
These are the 3 classical signs of what? Diabetes.
Okay.
So someone will ask, what are they? What are these big terms? So let's look at them one by one.
Okay.
So let's look at polyuria. Means the person will urinate more, frequent urination. So what happens for the person to urinate more? Okay, as I said the glucose must enter into the cells, but in diabetes the glucose are in the blood.
Okay.
I get it.
Sure.
And then the blood carries all the waste substances in the body. I get it. So the blood will go into the kidney. The kidney, there will be urine formation.
Sure.
And if urine formation, we have filtration, absorption, selective free absorption, and a whole lot. I get it. Since the glucose are much in the blood, when it enters into the kidneys are not able to filter all the glucose.
Okay.
Okay, so they will pass through the process and enter into the next process, which is absorption. And since the glucose are still much in the urine, the body cannot absorb all the glucose.
Okay.
So the person will be passing out most of the glucose. And there's a saying that where there is sugar, there is water. So when the person is passing more glucose, there will be more water. I get it. So the person will be urinating more frequently.
Okay.
And when the person is urinating more, the person will be dehydrated. I get it.
The person will be losing fluid.
The person will be losing fluid because the person is urinating more. And then when you are losing fluid, you'll be dehydrated. You will have dry mouth, dry mucosa, and a whole lot of them. So the senses, the taste senses will be stimulated. Okay, because you're losing fluid. So the taste senses will be stimulated. And then when the taste senses are stimulated, that's where you'll be drinking more. Because you're losing more fluid. So you have to drink more to replace it.
Oh, I see.
That is polydipsia. You are drinking more. That's the meaning of what polydipsia. As a result of you losing more fluid, you have to drink more to what replace it. I get it. So that is the thing polydips say. Let's look at the polyphagia. Step one. When you eat, the glucose in the blood must enter into the cells with the help of the insulin. Okay. So in the case when the pancreas is damaged or destroyed and there is no insulin production, the glucose in the blood cannot enter into the cells. Okay. And when the glucose enter in the cells, that's where you're getting energy.
Yeah.
But in your diabetes, the glucose are not getting into the cells, so you're not getting energy. So the person will try to eat more to get energy. Meanwhile, when the person eats, still it remains into the blood. So the person will try eating more because the person feels the person doesn't have any energy. I getting it. So the person will try to eat more to get energy. I get. Apart from these three signs, we have other signs which are related to that. Weight loss. Those with diabetes, you see that they will be losing weight. Why? Because the person don't have energy and the body wants energy. So the body will try to break down the fat and the person will be growing or losing weight. Apart from that, we have some frequent infection because the immune system of such people is reduced. So they can't fight against infections. So anytime the person will be having what? Frequent infection. Okay. The next one is what? Foot ulcers. Poor wound healing. For such patients, they have poor wound healing. Either because of their condition. Another one is what? Impotence. Impotence, yes. And then
for the men?
For the men. And then for the women, they will having vaginal candida.
Oh, wow.
They are all associated with what? Diabetes. Blood vision. Okay. You can't exhaust all. There are many of them. Many of them.
Because of that time.
Fatigue. The dizziness all are associated with what? Diabetes.
Wow, this is great. Thank you so much for this great teaching. We would end here too. Thank you so much. Viewers, please, this is all about causes and then signs and symptoms of DM. Please stay tuned and do remember to subscribe to our channel, like it and share your comment with us. Remember, I love you. Stay blessed.